Advanced care planning is shared decision-making between the physician and the patient about the treatments they wish to receive if they are unable to speak for themselves. These decisions are based on the patient's values, preferences, and discussions with loved ones. Advanced care planning is part of the 13 components of the Institute of Medicine Care Plan and is a requirement for the oncology care model and other alternative payment models.
We want to make sure that we understand what's important to patients, and that's advanced care planning. Having conversations with them, not just about chemotherapy and testing, those types of things, but talking about their values. And this is something we think is very important. We think it engages the patient, it gives the patient an opportunity to really tell their side of the story.
I think advanced care planning lets the patient have a real voice in this shared decision-making that we're striving for, and we are taught to respect that voice and gel that with kind of our medical opinion on the patient and what our limitations to treatment might be.
Advanced care planning is important for overall patient outcomes. So in alternative payment models, or without alternative payment models, it's also important, but a big component of the drivers of healthcare costs are end-of-life care. And not appropriate end-of-life care, but the end-of-life care that doesn't really result in anything of benefit.
We do believe that advanced care planning improves patient care. Patients have a chance to really talk about their goals and values, about their wishes towards the end of life, and so that it enables the physician and other members of the team to really make sure that we're meeting patients' values throughout the course of their cancer journey.
Having advanced care planning discussions with patients can be difficult. Advanced care planning can be a conversation that takes place with the patient and their physician or advanced practice provider. Finding the right talent in your practice is important and can vary from practice to practice.
There's no question that patients are going to need access to advanced care planning, thinking about goals of care in the future, and that the APPs could play a critical role in that. These are very difficult issues to talk about. Not everybody kind of has the skill set to do these. I think the oncology care model is going to force us to look for those people who are talented at engaging in conversations with patients about end-of-life issues, with the ultimate goal of improving the dying experience for those patients who have incurable disease.
So I'll usually open it up and say in the course of discussion of their disease, you have a stage 4 cancer, we can treat this, and by treatment, we can help you live longer and have a better quality of life, but we can't make it go away and not be a problem. It is going to be life-limiting. Therefore, we want to make sure that we are doing care in accordance with your wishes.
We started a process where patients with metastatic cancer were automatically set up for advanced care planning visits rather than having the physician do that themselves. So the nurses were enabled to have those conversations with patients and set up those visits with our APP for that program.